First of all, I just wanted to say thank you very much for allowing us to come here and to talk to you today, and also to allow us to work with the Sydney Local Health District. It's been one of the most exciting parts of my job is to work with things that I hold dear, that I'm really passionate about. And I'm incredibly passionate about mobile technology and gadgets and that kind of thing. But also, in my early years, having a degree in molecular biology, the combination of those two things together, to be able to bring them together is really, really exciting. So today, you saw the video as to what is innovation. I've got an explanation of what I think innovation is and what we at Tigerspike think about when we talk about innovation. And I'm going to sort of try and put those two things together just to set this up for everybody. Everybody sitting in this audience is probably much smarter than I am, much more kind of engaged in kind of the healthcare industry than we are. But I think where we combine what we understand and the knowledge that everybody here has, we can create amazing things. And just to touch on sort of what our sort of company values are, as Dave mentioned, the trust and the innovation piece, that is very much what we stand for. We talk about our sort of mantra is to improve people's lives through technology. And interestingly enough, everybody here is sort of much more directly involved in saving people's lives, but we like to think we improve people's lives. And what we mean by that is not necessarily that we're sort of making incredible advances in technology or sort of amazing new things. What we're talking about is allowing people to do more with what they have. If someone who kind of does his job every day and has to go in on a Saturday to finish up in order to be ready for a Monday morning, if we can use technology or mobiles and tablets to allow him to do his job quicker, to get home to his family, to allow him to sort of get on with what they're doing, to allow someone who works with children to be able to do something better than what they would able to be do through mobile technology, then we think that's amazing. We also like to look at things that happen around the world. So we've got an incredible team. There's a lot of them here today who I think will be talking to you all throughout the day. It'd be great if you could sort of catch up with them. And we've got 8 offices around the world, about 240 people. And we try and bring innovation and innovative thinking from all our different offices together. What happens in Sydney and where Sydney leads the way in a lot of areas, we hope to apply to our offices in the US, which sometimes are behind, as Teresa and I were talking about just before this, even though you wouldn't necessarily think that. So for me, when I like to think about innovation, for me it's a combination of things. It isn't one thing that sort of suddenly sort of leaps out and is innovative. It's all about what's possible with the technology, and that's where I think certainly we like to think we're sort of the experts in that. We like to think we know what you can do with technology, but it might be completely irrelevant to the people we're talking to if it doesn't actually do anything, if it doesn't help them get ahead, if it isn't actually viable in a marketplace, whether it's healthcare or retail or government or whatever it might be. It's really important that the technology actually has an impact on people's lives. And then it has to be desirable to users. Teresa mentioned Facebook. People use it because they love it, they get something out of it. It's desirable to them to use it. And users are not just sort of patients or consumers, they're also healthcare professionals, as sort of many people in this room are, or administrators. They've got to actually want to use something. It's got to make a difference to their lives. And where we see sort of real excitement is where those three things come together, and that's where innovation sort of really can have an impact on people's lives and make a difference. And I guess another point which you saw in the video was the research piece. So for us, sort of drilling down on sort of the broader area of innovation, down into more sort of specific to healthcare and where Tigerspike sort of fits in on that, it's not about some gigantic improvement in one particular thing, which does come around and happens from time to time. And when I was at Durham, that was definitely something that we were working on. But often it's very small changes, small improvements in the way in which we do things that then brings about that transformation that does change people's lives. If you look at it from a macro perspective, you might look at the changes over the last 10 years in the healthcare industry and think, my gosh, there's been this sort of tidal wave of change. But when you're in it every day, as everybody here is, they're very small steps towards making small innovative changes that has an impact on how we do our jobs. So I guess just to sort of, that sort of sets up the innovation piece. And then what I wanted to do was talk about why mobile, and why is Tigerspike here? What can we do that kind of has an impact and can make a difference? And really, mobile is such an important part of everybody's lives and such an important part of the healthcare industry as a whole. It's an essential part of pretty much every sort of patient, consumer, everybody around the world. And mobile health apps are exploding. Apple and Google have done huge amounts of work in that. And a lot of everybody sort of jumped on this bandwagon. 500 million people using mobile health apps this year alone. And we don't see that slowing down at all. It's fascinating to think how, where it could go. What could you possibly do? There's over 400 healthcare applications in Apple's App Store, similar number on Google. You mentioned Facebook again, Doximity. I don't know how many people use that, but it's a social network for clinicians and for doctors. Used a lot. Two of my best friends, they went on to become doctors after we did our molecular biology degree together, and they were talking about, I said, how do you guys share information? Because they're not particularly sort of technology savvy. They didn't really sort of, weren't really into it. They don't sit at desks and check their email all day like I do. And they were talking about this application and how they can find out about the latest procedures. They can share stuff that happened instantaneously without it being something that you would necessarily share with someone on Facebook who might not understand what you're talking about. So really interesting how this sort of technology comes together and how people in the healthcare industry are sort of coming together and using technology to improve the way they provide the healthcare that we all expect, or we've come to expect. So I wanted to touch on some of sort of today's devices and what you can do with technology. I'm going to go through 3 areas that you can use wearables. We've got some examples here of what you can do with technology. But just to sort of set it up, there's an explosion of devices and capabilities of things that involve mobile and wearables and that kind of thing. And where we think about it at Tigerspike is things that are sort of around me, sort of close to the body, things that I actually have on my body and that communicate with my device, and then things that are in the body, things I might either inject or insert or whatever it might be. And you've got some examples outside with some of the sponsors here of those types of things. But central to all of that is the mobile device. And we really believe that the mobile is a hub for all of the data that's coming from whatever device it might be. And it's what you do with that data that's important. So I'm going to try a live demo, because I love doing those on stage. It's always good. Just to talk about some of the things that are possible with devices. So what you're seeing now is my mobile. Oh, everybody has, the average number of applications on a device is about 140 applications. So most people have those. I've got about 300 on my phone. Most of which I use. This is my healthcare pages, lots of different things to do on here. And what we're going to do is we'll actually take, this is Rebecca, a colleague of mine, she works in the innovation team here in Sydney. And we're going to take her blood pressure. So once we've got the application up, I put on the pressure cuff without bashing against my microphone too many times.
I'm very nervous.
So we're going to do a couple of things, just to see if it works. And to give an example, I'm going to talk about why I think this is interesting, and some of the good things about it, and I guess the bad things about it as well. So here it's pulled up. It's under my profile, so unfortunately this means that whatever her blood pressure is will go into my profile. So again, that's an area where it could go horribly wrong if I'm taking different people's kind of blood pressure. But if I start this now, she said it gets quite painful after a while. But anyway, what this is actually doing is it's taking her blood pressure live, and then it's going to be stored in my phone. And it also will record her heart rate, and I'll take my heart rate as well. We can see how excited we are to be here on stage in front of everybody. So it takes a bit of time, but very simple. And I guess the other thing you can do is I also have the Kinsa, which is a digital thermometer, which I was going to. Measurement failed. She's too excited. She's getting. Just relax. There we go. I did it the first time I did it. I was sort of walking around on stage, swinging my arm like this, and it failed. And I was like, oh, that's not right. And then I read the instructions, and you have to sit down and be calm and rest and relax. So the other thing was we can take her temperature and that sort of thing. And I guess the interesting thing is that I'm in no way, shape, or form a medical professional. And my interpretation of that information is something that I think is really, really interesting. Hopefully it'll work this time. If I see something that's oh, no, you're wearing it wrong. You're letting me down. We'll go into blood pressure. There we go. So you can see this is what the blood pressure was earlier, just before we stepped. So 115 over 75, taken on the 28th at 4:45 p.m., and her heart rate was 90, so she was quite excited to be here. Just to give you an example of how you take the heart rate, that uses the camera on the phone. It turns the light on, and then I place my finger over the front of the camera, and I can take my pulse. So again, using sort of different parts of technology and devices we have with us, I can start to sort of build up a picture of what's important to me. And the blood pressure thing in particular was important because from my perspective, my father died in his 50s of a heart attack, oh, there we go, it starts taking my heart. Oh, I'm really excited, 94. My resting heart rate's about 65, so obviously standing on stage is elevating my heart rate, obviously. Thank you very much, Rebecca, that was great. That didn't work at all, so... The interesting thing is that, as I said, my father died in his 50s of a coronary heart problem, and so obviously that means that there's sort of family history, there may be a risk. As I get older, keeping a track of my blood pressure and understanding what it is over time is important, and if I'm able to sort of understand what this information means, and there's a huge amount of information here just about what I've been doing since I've had the device, how it all relates together. If I can understand that and communicate that effectively with a healthcare professional, then I can start to understand when I'm at a higher risk, when I need to start changing my diet, making all of those healthcare changes, or those lifestyle changes that I might need to do. So the other thing, just to sort of demonstrate, is that one of the things Apple has done with its health kit is allow all of this information to be put onto a dashboard and stored. So here I've got walking distance, running distance, the active calories, heart rate, blood pressure, body temperature, SpO2, oxygen saturation. All of this data is here, which is a huge amount of information being sort of generated, lots and lots of data sort of being collected. Now if I get back to this without, oh, there you go, live demo. So that's the pulse oximeter, which we have as well. And the interesting thing is that I need these wearable devices. I need this technology to do it. But as you can see with the camera on the phone, that stuff is starting to be integrated into our daily lives. We're starting to have it as wearable technology where it's integrated into our clothing, and this data is just being collected constantly. I have the Apple Watch. That takes my heart rate every 5 minutes. And over time, throughout the day, I can see what's happening, different things. When I've had a big meal or something like that, I can see what changes that is. And I think at the moment, it's a bit of information overload. There's definitely, one of the phrases I heard was a digichondriac, someone who's so sort of focused on the information, and it's completely true. I play a lot of squash, and a friend of mine had a continuous heart rate monitor, and he was playing, we play competitively in Singapore, and he played his second game, and he looked down at his watch, and it said his heart rate was 192. And he said he felt that was too high, and he thought that if his heart rate was over 190, he needs to stop, he needs to kind of relax. And he lost the third game, and we lost the match. And I thought, okay, fair enough. I mean, but if he'd never been wearing the watch, he would never have known, and he would have put in the most effort he could. But he could also have had an issue on court, and that would have been far worse. So it's very much a balance of how I interpret the information and how I personally make changes. Am I too excited? Am I overexerting myself? Is my blood pressure continuously high for a period of 2 or 3 months, which might trigger me to go and see somebody and talk about it? And I think the other area from this aspect is kind of mental health as well. There's a lot of applications coming onto mobile devices that help me talk about my mood, talk about emotion, talk about my stress levels, all of those sorts of things. And I think that is a fascinating area of research, something that we at Tigerspike are quite passionate about. Individuals have come to us from within Tigerspike and said, how can we do something which tracks how happy people are at work? We've developed an application called Happy Suite just to sort of try and see and quantify what people are doing. And depression is a very sort of serious thing across all the world, and particularly here in New South Wales. I think it's really interesting to see what initiatives can be done. But it's equally important to not start to rely on technology. Like I was saying, it's really important that we don't just think about tech in that sort of way. So 3 of the areas I'm going to talk about, one is sort of the monitoring and diagnosis with these sorts of devices, and we've touched on that now. We'll talk about research and some of the initiatives that mobile and sort of that sort of technology is doing, and then sort of operational efficiency. This is something we've been working closely with Sydney Local Health District and with other organizations to see how mobiles can help, and I guess we like to think help, but if there's huge amounts of data, they may even hinder the efficiency that people can actually perform their jobs. If I come in and I say, oh, my blood pressure is really high, and they said, well, that's because you went to McDonald's 10 minutes ago, that's a complete waste of time of me going to a doctor. So how does education fit into that? How do we think about mobiles and tablets, and as healthcare professionals and technologists, think about how the average consumer is going to react to this kind of information? So just some examples of some of the stuff that I think is sort of at the forefront, and we've talked about being at the cutting edge of technology in terms of what's possible. Things like, this is a wearable dialysis machine, so instead of having to go to the hospital all the time, I can do that. It communicates closely with mobile device. There's an application which tells me a lot of information that's going on, and it can be monitored by my physician, my clinician, who can sort of see what's happening and what I'm doing. This is for looking at blood vessels in the eye, using the camera on the phone, interpreting that information and sending it for sort of remote healthcare. Taking blood pressure. This is something that's from a company called Scanadu in the US, where I can do urine analysis on my own. It plugs into my phone once I've sort of cleaned it. And tells me a whole range of things which can then be stored on my device, and then done something with, communicated directly and securely to my doctor. And I think one thing to just sort of touch on in that regard is that security piece, because as soon as I start using this information, this is the Medtronic heart rate monitor, so it communicates with the device and then actually sends the information directly into a central server, which can be accessed by healthcare professionals. As soon as I've gathered this information, I've monitored myself, I've diagnosed it from a urine sample or whatever it might be, and then that information is kind of stored in my phone and then communicated, however, to a clinician. The security of that data is really, really important. How does it not fall into the hands of the insurance companies who say, Oliver, your blood pressure's been high for the last 3 months according to the device that I was wearing wrong and using incorrectly, therefore my insurance premium goes up. And I think those are the sorts of things that we like to think we can help people navigate through. We work with legal, with kind of administrators. How can they understand that information? And then one of the areas that we think is really important is how is that information going to be presented? How is it going to be actually viable for a doctor who's time-pressed, time-poor, to be able to see the critical pieces of information that he needs and be able to sort of sort out the wheat from the chaff and understand that it's actually completely pointless that these devices aren't making any difference to my healthcare because I'm perfectly healthy. I'm just a digichondriac, as we talked about. But equally, if it does show that there are something that could have an impact on my health, and he can spot that earlier than he could otherwise, or she could make changes to the way in which I decide to do things, I think it's really, really important that we allow that to happen through innovation. We enable those sorts of things to occur. So the next area sort of to talk about, I'm just touching on a few topics. So I guess the main thing from that perspective is that healthcare is such a huge, huge area. And as sort of more on the technology side of things, for us it's about how can we help whatever problem it is that you might be trying to solve. So from a research and aftercare perspective, I think that's where mobile can have a huge impact. From the research angle, Apple has done a huge amount of work with their Health Kit application and initiative that they've launched. It focuses on sort of 5 key areas initially, but really some of the key things to remember is it's not just about, the cardiovascular one is with University of Cambridge, I think, and it's supposed to be the largest study of cardiovascular disease ever performed. It's collecting huge amounts of information because everybody's carrying around a mobile device. They're all able to record the characteristics and the sort of things that they need to be able to do, and then that data can be pulled back and analyzed. Things like asthma is fascinating because not only is it recording when you may use your puffer or when you have an asthma attack, but it's also pulling in air quality information from external sources. So it knows that there's an extremely high pollen count, and therefore that may be causing it. Or they know that pollution is high for 3 or 4 days in that region. So it's not just about measuring what's going on the device and with the individual. It's about how external factors could contribute to that, which is really, really aiding in research around the world. And just a couple of other things. This is the sort of way in which people can work together, the process that's involved, the way in which you can sort of bring healthcare and technology together to come up with new applications around testing people's gait, seeing if that could be affecting Parkinson's or Alzheimer's or whatever it might be. And in aged care, we think there's enormous potential for these devices to sort of have an impact on that kind of area. And then finally, sort of the operational efficiency. How can sort of mobiles and tablets be used to improve what people are doing in their daily lives? And a lot of it is sort of treating patients, but Teresa and I were talking earlier, sometimes it's the getting around, the getting from A to B, the transactional piece, the administration that goes on with a job. And whether it's navigating around a hospital, whether it's improving sort of patient flow, whether it's improving those systems, I think that's an area from an innovation perspective that's really, really important and something that mobile and tablet technology can have a huge impact on. The other one that particularly, it's not a very clear image, but that's an application that we built for the George Institute here in New South Wales for the Aboriginal community, for Indigenous community. It's called One Deadly Step, and deadly means cool, so it's one cool step. And what it does is it allows members of staff from the George Institute to go into communities and collect information and lifestyle characteristics and healthcare information from people who would never go and visit a hospital, would never go and see a GP. They bring that information back to Sydney, and they process that information, and they can alert local GPs that there may be a particular issue with somebody in a community. And that GP can go and visit the community and carry out sort of aftercare or primary care for people in indigenous communities, which we think, for us, we just enable it to happen on tablets. But to actually go out and improve people's lives and bring healthcare to sort of remote communities is amazing. So we work on some super exciting projects, which initially you don't necessarily see the impact they're going to have, but to hear how they can change people's lives for us is really exciting. And just sort of finally to touch on some of the cool things, I guess this is sort of innovation, it's where things are going. I think we're really right at the start of what's possible with the technology. It's now that these devices are in people's hands. We think the Apple Watch is going to have a huge impact on, obviously, slightly more developed country health as opposed to developing countries. But there are areas where things are changing what everybody does. So whether it's the sort of the typical telehealth type thing, this was done by a clinician who was 400 kilometers away from the patient. It was a sort of a one-off. This is a project by Google where they're using contact lenses to measure the glucose level using in people's blood. So from a diabetic perspective, the fascinating kind of research project. Airline pilots spend 10,000 hours in a simulator before they're let near an actual plane. So being able to use something like the Oculus Rift to do sort of 3D immersive surgery and actually practice and practice and practice virtually before the next step and the next step will improve the sort of the care and the education and the way in which sort of healthcare is performed. And then finally, this is a gentleman that I met at an innovation conference in Cannes who took a 3D printer and went out to sub-Saharan Africa and was printing 3D limbs from his printer in a shed for people who'd been victims of landmines or sort of violence in that area. And he treated 400 patients before the stuff in his 3D printer ran out. And then he had to go back to San Francisco and get more. And just an incredible story of kind of using technology and innovation to really make a difference to people's lives.